CDC official is warning that the coronavirus is spreading too rapidly and too broadly for the U.S. to bring it under control. Pretty dire words. The comments come nearly three quarters of all U.S. states report a spike in confirmed COVID-19 cases and hospitalizations. At least 16 states are halting reopening plans altogether. Yesterday alone, the U.S. reported more than 41,000 new cases. The death rate has not risen as fast as case numbers, though, but U.S. officials warn that that could change soon without action. So New York pediatrician Dr. Dyan Hes has been following all the developments and has been joining us throughout this whole thing, and you are here now. So this hearing today, Doctor, is going to be looking at moving forward in terms of opening up schools and workplaces. But we're dealing with, some people say the continued first wave. Other people have called it a second wave of infections. Is there a safe way to go back to work and school?
I think in areas where the rate of increase is around 10% of cases now, you definitely should not be reopening. I mean, this is an embarrassment for our country. I mean, we're in New York. We've worked so hard to keep our numbers down. We've done such a great job. I wanted to send my daughter to a sleepaway camp for 2 weeks, but I decided not to now because I cannot rely on the fact that kids coming from other states have done as well as we have, and they might have been exposed. So this needed to be a national project. This needed to be a national program where everybody was quarantined and everybody followed the same rules with masks. But that is not what has happened, and we have literally become a public health disaster. I think it's going to have to be state by state, county by county.
Dr. Hes, we're probably going to have to wrap this up soon because the hearing on Capitol Hill is starting. But I just want to really briefly ask you, the American Academy of Pediatrics is calling for children to return to schools despite the pandemic. They say severe learning loss and increased social isolation can lead to serious health issues. What's your thought on that?
I completely agree. I completely agree about that, but you cannot have kids going back to school when their parents are in an area where the rate is spreading so high. It's like, the kids are collateral damage. It's very sad that adults can't be responsible to wear masks, but you can't have teachers coming in who might spread it to the kids who might bring it home and vice versa. Yes, the children are not super shedders, but we do know that they can transmit. It's not that they can't transmit. They don't do it as much. So really, our children in the United States are suffering from the actions of adults who have not been responsible. If your rate is low, like we have in New York now and other states, you should be able to go back to school with those safety precautions in motion. And some kids will have to learn on Zoom or online because they're at risk. And some families won't be able to send their kids because the parents might be at risk. But those states and those cities that have really followed and buckled down and gotten this under control should be allowed to send their kids back to school. I can't say that for the states with high rates.